Uh, Good morning to all. In continuation of the previous presentation, my paper is a comparative study of clinical features and visual outcome of endophthalmitis in case of traumatic and non-traumatic etiologies. The visual outcome following open globe injury is very poor because of numerous factors and numerous numerous variables. But endophthalmitis is one of the most devastating complications. The reported rate of endophthalmitis following open globe injury is 0.9 to 17%. In order to identify the factors affecting the prognosis of traumatic versus postoperative endophthalmitis, we retrospectively reviewed the cause of exogenous endophthalmitis. Clinically, if we see, these are the picture, and the pictures are definitely different. They are not the same because primary injury is evidence of primary injury is visible. After ethical clearance, we retrospectively review all details, demographic and clinical data between 2008 and 2022. At our institute, according to, we treated all patients, traumatic as well as non-traumatic, according to endophthalmitis vitrectomy study guidelines. Vitrectomy and intravitreal antibiotics were added to the treatment according to the presenting vision. If vision is more than HM, then the intravitreal injections were given, and if it is less than HM, then directly surgery was given. We had given intravitreal injections which are standard according to the EVS. All data exported from EMR and analyzed with SPSS 25. We found our cohort consisted of 114 eyes and 46 were post-traumatic and 56 were following surgery. The cohort consisted of 56% male and 44% female, and mean age was 45. The overall outcome is 26, means 22.8 patients achieved more than 660 vision, and 11% approximately achieved more than 624 vision. While investigating the visual outcome, we found the significant difference between pre and post treatment with the p-value 0, and when we compared it with the traumatic and non-traumatic etiology, we did not find any significant difference. While comparing the adult and pediatric cases, we found that adults are doing better than children. 35% cases are treated only with the medical treatment, and surgical treatment has better outcome with p-value 0.001. 10.2% remained no PL, and mean number of injections were 1.38 and mean number of surgeries were 1.11. Destructive procedures were done in 2 cases. So these are the demographic data, and wooden stick and wooden thorn was the most common cause of injury. And here are the comparative study of pre and post of vision, and the vision statement already is done. So when we studied all these variables, we found that presenting vision, corneal sign, particularly corneal infiltration, type of injury in open globe injury, either globe rupture or penetrating, type of intervention, surgical or medical, age group, pediatric or adult, or posterior segment finding has a significant impact on visual outcome. This is the table where we have compared all the data from post-operative and post-traumatic cases, and we found that no significant difference amongst any variable here. So my conclusion is descriptive analysis and cross-tabulation identified the presenting vision, corneal condition, vitreous opacities, and pediatric age group at high risk of developing endophthalmitis and poor outcome. The type of intervention, subconjunctival and intravitreal antibiotic injection at the time of globe closure, was associated with decreased risk of developing endophthalmitis. Comparative study of visual outcome among the traumatic and non-traumatic causes did not show any significant difference, and these are the references. Thank you.
Thank you, sir.